Good day, I am Sean Ranzupi JARAVATA. Today I will be performing the 3 return demonstrations on the obstetric history of the pregnant woman, then the taking of vital signs, and then the Leopold's maneuver. So first things first, upon entering the room, of course I will do proper hand washing, but since a viable sink is not available as of the moment, I will be using my hand sanitizer or alcohol to deter the spread of microorganisms. So upon doing this, before entering the room, we have to ensure that we do not barge in the room. We have to enter respectfully, and then we have to confirm if we are handling the correct patient. So assuming that upon entering the room, ma'am, good morning. I am Sean Ranzupi JARAVATA, an attending student nurse for the hospital. So to know if you are my client for this morning, I would like to check now by your name and your birthday, okay? So may I ask for your full name po?
My full name is Kendall Gender.
Okay, ma'am. How would you prefer to be called po?
Ken na lang.
Okay, ma'am. Then your birthday po?
September 5, 2000.
Okay. So upon confirming with the client that her name and her birthday, I have confirmed that I am handling the correct patient. So ma'am, would it be alright if I sit down po?
Of course.
Okay, thank you ma'am. So ma'am, this morning, we will be, the doctor has ordered me to give you the obstetric history or the OB history. So as to monitor your current pregnancy together with your current health status as well, no? We are going to check if everything is going well, and if there may be some irregularities, then we get to address them immediately if there are any. Hopefully wala naman, no? Then second is of course we'll be taking your vital signs. So si vital signs po ma'am, this will give us baseline data, no? Like your temperature, your pulse rate, how fast your heart beats ba, then you have the respiratory rate, how fast you breathe, and then yung the pulse rate, I mean the blood pressure, wherein of course we'll be using the sphygmomanometer, or better known, no, as the BP apparatus. So we'll just get your blood pressure to see if there are any changes. Okay? So lastly, we will be doing this what we call Leopold's maneuver. So this will help us identify what the positioning of your fetus or the baby inside the suna, the position, if is it transverse ba, is it nakatayo pa siya, or yung mga longitudinal, is it longitudinal, is it oblique, slanting, and then we get to find the fetal back. All of those details, which of course I'll be explaining naman din as we progress along the way para di po kayo mabibig.
Yes.
Okay? So, for anything else, is this your first time po ba having your prenatal?
Hindi po, sir.
Hindi po. So, upon checking din naman, no, you have already your previous results. So, it is good that you come and consult, and I commend you for that. And please continue to do so, no? So that we can give you the best possible help that we can give. Okay? So with that being said, let's start with the history po.
Yes po. Let's
Okay.
go.
So before we proceed now, I'd like to inform you lang din po that everything that will be disclosed or gathered this afternoon, mga information that we'll be sharing, will remain private and confidential. Okay? So you do not need to worry about it being disclosed to other people. It will only be between the both of us and of course to your designated health team or health physician.
Yes, tayo.
Okay? So do you have any more questions or concerns?
Sa katong Leopold, sir, pwede na ko malunggan yung heartbeat. So maybe sir.
Oh sure, if you please remind me again lang later na after we find the fetal back, and then I get to locate na the heart tone or yung beat na ng baby, then you will get to hear it now. It will be a good bonding between you and your baby to listen to him or her within you. Okay? Sige. So, let's proceed. So, ma'am, I'd like to confirm again na po, no, your may I ask for your full name once again?
Kendall Gender.
Kendall Gender. Okay. Then, may I ask for your address po?
Beverly Hills po, California.
Okay, Beverly Hills, California. Then, hospital, of course, hospital. Then, ma'am, may I ask lang po, si Mr. po, is he here with you?
Wala, sir. He just dropped me off. Ibaba niya lang po ako, tapos nag-proceed na po siya sa work.
Okay, if you don't, upon confirming, I'll just confirm, if you don't mind me asking, married po ba?
Yes po. Happy.
Yes, congratulations. And then, may I ask for your occupation po, ma'am?
Model ako dati, sir, when I was still not pregnant.
See. So, yes, we will proceed na, no? Just a little background lang of your maternal history or yung pagbuntis mo, you know. So this will give us a background on the process from when you started yung first menstrual period up until the current one. So you can trace anything that needs to be attended to. Okay? So we're going to start with when did you first, or how old were you when you had your first period?
13 years old po, sir. 13 years old po.
Okay? Then, with that being said, no? Sige, 13 years old. And then, might I ask na lang din po, no? Your last menstrual period or the first day of your last men's.
Before ko na anak buntis po.
Yes, yes.
June 23, 2025. Last year.
Okay. June 23, 2025. So, ma'am, of course, we can compute naman dito. Are you aware na po ba how many weeks si baby as of last moment?
Hindi ako masyadong sure.
So we can compute that, no? So if your last menstrual period was June 23, 2025, upon computation of the natural rule, so move na natin June, July, August. Okay, so your age of gestation is approximately, no? Or if I'm not mistaken, you can confirm that better with the ultrasound and or yung measuring of the fungal height. But as of now, no, we can say it is about 30 weeks. And then, your estimated date of delivery, yung expected date ng mga anak po kayo, is on March 13, 2026.
Okay.
Okay?
Good na?
Yes. Fit na good, no? So it is good na frequent po kayo bumabalik dito to ensure that you're viable for this. So let's proceed. And then, sige, so let's look at your, ano po, no, yung first menstrual period ninyo, yung 13 years old, when you were 13 years old. 13 years old. When was, well, if you remember, so po, what year would you say did you have your first menstrual period?
2012 yun, sir.
Yeah.
Since, ano po, June 2022.
Okay, so it is also no given or it matches with your previous record na it says July 2022. So would you say, how long would you say no are the menstrual menses that you had or yung intervals before you would have another set of menstruation?
Normal po, sir, 28 days.
No, 28 days. Okay. And then, ang duration po ng menses, how long do your menses last?
Regularly, mga 4 days.
4 days.
Ang bleeding.
Then, how many sanitary pads would you say na you consume in a day?
In a day, I can consume about 5 to 6.
Alright, so almost healthy na siya, moderate.
Po, moderate na po siya.
Moderate. Sige. Okay, take note of that. And then, do you have any symptoms of like, do you have abdominal pain with this or you have back pains with going with this? You know, you have
Thankfully, sir, wala.
wala.
Favorite po ako nila.
Yes. And he loves you for that. Anyway, let's proceed. So we then go to, okay. So may I ask if this is your first pregnancy?
Yes po. Kinda nervous.
So don't worry, we will be with you in the duration of your pregnancy. So we will give you the best care that we can, no? So to clarify on your first pregnancy, so you did not have any previous like abortions to, or yung mga emergent that you have your fetus to be removed ba, or
Yes po.
None, so none po.
Wala.
Okay.
First time ko po talaga.
First time. Okay. So, I'm just going to ask you with some symptoms lang to see no, if there are maybe any abnormalities or if you're currently experiencing a normal pregnancy.
Sir, regarding po sa normal pregnancy po, feel ko po nagtaba po ako masyado.
Okay, sige. So, let's check no, your height is 16, okay. 16 cm. So, upon checking your BMI, no, pasok naman siya sa normal, but let's check na lang your gain, no? So, upon your last prenatal check-up, so this was, I think, your first trimester, first trimester, 58.5 kilograms. And then, am I correct po ba? Were you weighed outside?
Yes po, kanina.
Do you remember po ba?
62 naman yata po, sir. 62.5.
So the attending outside no wrote 62.5 kilograms. So if you were to check naman from 58.5 to 62.5 kilograms, then it is the optimal amount of weight gain naman.
Normal lang po siya.
Yes, it is normal. So ma'am, we have to expect po talaga that there is a gradual increase, of course, of your weight because the baby within you is also growing together with you.
Thank you, sir.
And your body is also preparing itself to handle the baby within you. That is why your body tends to become heavier. No? Sige, but do not need to worry. And it is good that you raise that concern because a lot, actually, they do die. They cut their eating. They do diets. It is this because just to tell you quite frankly, this is not the time to do diet courses.
Yes po.
Because you're supplying for both you and your baby. So you have to give the both of you enough nutrients and food to sustain them. Okay? So let's proceed to yung symptoms. Tell me if you have them or if they are absent. Okay?
Yes po.
So are you currently are you not experiencing any menstruation or is there an absence of menstruation?
Opo. Wala pa po akong bleeding, thankfully.
Okay, that's good. So there might be something wrong if you're already pregnant and there's still
Yes po.
it might not be menstruation now because maybe things get to refer. But since wala, proceed. Do you currently feel any nausea or vomiting?
Well, at the start, sir, first trimester, especially sa morning, nausea and vomiting talaga.
Would you
Sir,
say how many
right?
weeks po yun siya?
Like first trimester,
First trimester is
but ngayon pa wala na po.
so mga 12 weeks below ganun.
Yes.
Okay. So let's proceed then. Do you currently feel any pressure or pain on your breast po ba?
None, sir.
Okay. Do you feel or do you notice any changes about when urinating or the frequency of
Yes,
how
sir.
you urinate?
Mas madalas na po ako mag-ihi ngayon.
I see. So that is actually normal po, no? Because of course the size of the uterus and the size of your abdomen is pressing against your bladder. That is why you tend to urinate more frequently compared to before. Okay? Then do you notice any you get tired easily po ba or yung fatigue that as what we
Yes,
call
sir,
it?
so much. Especially if I'm standing for too long. Mas mapagod talaga ako. And then magsakit ang legs ko. So,
Legs. Okay, so sige, masakit yung legs. I'll take note of that. No? We'll go to the later one. Sige, have you noticed a dark line that connects from below your what we call the belly button
yes,
to the above of your vagina or your
yes.
pubic area?
Here from here, sir.
Yes.
Yes po.
So that is what we call the linea nigra. So the linea nigra is actually a normal occurrence during pregnancy. So that will eventually not go away lang naman din after the pregnancy or as time progresses.
Hindi po advisable, sir, kung lagay ako ng creams or
You do not have to put or it is not advised to put cream or anything external on it because actually it is part of normal pregnancy on the body.
it is beautiful.
Yes, because your imperfections are actually what makes you perfect. as what they say. Anyway, quickening. So, do you feel any movement within you, or do you feel the baby moving po?
Yes sir, malikot na po siya.
That's good to know. So, the moment that you do not notice any movement is the time when there might be something wrong.
Yes.
Especially with 30 weeks, no? And before that, especially sa second trimester, it should be that the baby will be really moving around. Kasi it's he or she's almost out na. So, malikot na yan siya, no? Okay. So, that's good. So, how frequent would you say does the baby move a day?
In a day, mga 1 or 2 sir. Manood ko talaga siya kasi masakit.
Nice. So, upon checking your facial naman din po, no? Or have you noticed any discoloration, hyperpigment, yung mga blackness sa face niyo po?
Wala.
So, this is what we call yung melasma. Kasi wala naman, we don't ever see. So, have you noticed any stretch marks on the sides of the
Sir,
upper? I see.
especially ngayon po na sobrang
So that is actually normal po, ma'am, no? Even if you're not pregnant, like, let's say for example, your rapid weight loss, so the stretch marks or the striae gravidarum are actually normal indicators na there has been an overstretch, your skin has been overstretched, and then eventually, no, as time goes by, it will go away lang naman skin. Okay, so you need them be. It is part the beauty of life. It is a normal bodily function that is given to you. So we have to appreciate this one, no?
It's a sign of strength.
Yes, because you're very perseverant in this pregnancy. To the point that these imperfections make you look even more.
Thank you po.
Anyway, let's proceed. How did you confirm your pregnancy po?
Yung first po. Nag-pregnancy test po kami.
Pregnancy test.
Yes.
Of course, I'm assuming it came out
Positive.
positive. Okay.
And then nag-follow up na po.
Nag-follow up. That's good.
That's why it was confirmed.
That's good. Okay. So the basic information we've actually covered the one enough. Let's proceed to a little bit of your general health lang muna.
Yes.
So we can get to see if there are any changes. So you mentioned a while ago that there was tiredness.
Yes sir.
Can you elaborate more on that?
I feel tired especially when I walk around a lot because I have to walk from our business to our house because it's just close, but for a pregnant woman it's pretty far. And then I've noticed also recently my ankles, like especially down there, it's ang tawag dun, sir, manas po siya po.
So would you say that it's more of like pressure, there are pressure on your ankles, you feel, or is it like pamaol kumbaga na?
But like pressure po, tapos like parang swell
Po siya, okay. So, sige. So this occurred po ba when during your pregnancy na po ba?
During
Has this
pregnancy.
happened before?
Ano po, during pregnancy.
Okay.
Ngayon po na naglaki na yung
Mm-hmm.
ang sabi po ni Doc na even like kasi po normal daw siya kasi naiipit na daw yung arteries ko.
So the doctor already examined you with
Yes,
this coma. Okay, so that is actually what we call.
Pwede ko lang po ito i-elevate. So,
Yeah, you can elevate that, and then that will actually boost blood flow, and then a fluid flow within your veins and arteries there. So actually, this is what we call yung edema po. No? So this is just fluid build up within you. Upon checking din po your records, no, the doctors also noted yung minimal pressure edema lang naman sa ankles natin, and the doctors noted that it is normal naman, examine naman siya. Sige lang, continue to tell your doctor if you still feel it so that your doctor can examine it in case it is out of the ordinary. Okay? Sige, so fluid build up lang yan siya, and then just elevate and rest lang.
yes,
Okay? Then, do you notice po ba any abdominal pain?
yes, so much. Here, sa taas, sir, magsakit. Parang siyang nagapunta.
Okay. So, that contraction is that you might be noticing, no? Clarify ko lang po muna, is this radiating? Does it spread out or is it stabbing the baby?
Ang di ko po ma-describe ang kung stabbing siya, basta ang pain ko sir, here lang siya sa abdomen. Hindi
So,
lang din siya.
sa top portion.
Opo, hindi siya nagkakalat.
Hindi siya nagkakalat. Okay. So, that is actually what we call po yung Braxton Hicks contractions. So, Braxton Hicks contractions, another common term for that are yung practice contractions and during pregnancy because the body is preparing, of course, for delivery of your baby. So, practicing na siya. It's preparing for optimal pregnancy. So, it's just starting to adapt para once you are about to deliver the baby with actual contractions, the body would not, hindi siya mabibigla.
So hindi po siya harmful to baby.
So the moment na we get to be concerned about contractions na is or yung too much contractions or yung there is stabbing pain. So along with the normal contractions that you feel there is another follow-up pain, this time more on sharp na siya na pain, feeling like may ma-update na kumbaga. So that may indicate, no, so without telling the patient, if the patient feels stabbing pain together with vaginal bleeding, so that may indicate kung ano yung abruptio placenta. But since wala namang bleeding and there is nothing accompanying with it, then there is nothing to be concerned of at the moment. But you can educate the patient to keep on track of the type of contractions or pain that she feels. Okay, so going back. So that being said, let's proceed to history lang po, no, of your vaginal area lang po, no, just a background lang so we can see if there are any the ordinary. So since you said you were feeling a bit of yung mga contractions, just to be safe, let's check lang for anything that comes out of the vagina po, no? Is there any discharge or yung do you notice any substance coming out of the vagina?
Yes po.
So can you describe the color?
For color sir, most of the time clear siya. May times na medyo around whitish pero more clear talaga siya.
Whitish, okay. So do you notice any smell po ba accompanying with pandantin naman?
Odorless naman.
Odorless.
Normal po.
Yeah, so actually the time that we might be concerned is when it comes out in green or yung another color besides white or clear, is it may indicate bacterial infection, lalo na if there's a smell. Of course, actually leading to the next question, is there any bleeding or fresh blood?
Wala.
Wala naman. So, of course, if there is bleeding coming out, then there must be something wrong inside the case. It is room for investigation. But since none naman, we can proceed. So how about, as you said also, no, frequent urination. In those frequent urinations, do you notice po ba any pain when urinating?
Hindi po. Are you referring ko ba kung mahirap po pumihi?
Yeah, are you having difficulty to pee or is there any pain?
Hindi po. Pero sige lang po ako pa. Sige lang po ako ihi. Pero in terms po, if makaihi ba ako ng mais, nakakaihi naman ako.
That's good. So there's nothing to be concerned. So if there's pain, no, probably UTI, urinary tract infections, or any kidney problems, so don't hesitate to inform immediately if you experience. Okay. And then, about, you said, no, yung fatigue, you get tired easily. Does it come with colds, cough, or runny nose?
Hindi, wala naman po. Ngayon po, dry cough lang kasi po medyo malamig po kanina sa hallway. So parang dry lang po ang throat ko. Later po, mawala naman po.
So, if there's flu-like symptoms like cough, sore throat, or even runny nose, then inform immediately po, no? Because as you might know, because you are pregnant, then you are high risk po and you are easily no, targeted by infections. So we have to do something about it as early as possible.
Yes, sir.
Okay. Then just a brief background lang po. I'll be asking about your current medications. So are you currently taking any medications po ba?
ang nag-prescribe si Doc sa akin dati, sir, folic acid, pero tapos na siya, yung dosage yung ibigay ni Doc, sabi niya, tapos na daw, sabi niya, inom ko na lang ngayon is iron, pero that time po kasi, like, wala na po kaming time to chat with Doc, kasi po, we were in a rush, so hindi ko po alam kung para sa ano po yung iron, so ginatay ko lang po siya kasi yun sabi niya.
Sige, so I'll explain po muna first the iron. No? So the iron is actually there to aid you for the absorption. It is not directly. Yes, it may supply you with a tad amount of iron, but actually si iron supplements po. These are actually there to aid you to absorb iron-rich food. So this is what we call yung iron natin na supplement. No? So si iron helps to absorb yung mga to supply your blood with yung what we call oxygen. So of course, oxygen is important for the good part, especially now if you're in pregnancy, then you have
Dalawa
to,
po kami.
you're getting it now.
Yes.
So we have to double the production of oxygen, to double the flow of red blood cells, because red blood cells carry oxygen to all parts of your body, especially sa baby during pregnancy. So yung iron supplements natin make you absorb better yung mga the oxygen or yung mga iron within the food. So if you eat, let's say for example, ampalaya, you eat ampalaya and then you already took iron supplements, then your body gets better at absorbing this, making it more efficient for the body to take the nutrients, especially iron. That's why you take iron supplements. Okay? So as you said, yes, you're taking iron. Sige, balikan natin siya, no? We'll go to folic acid muna. So how about, are you aware of my folic acid?
Hindi po. Ay, folic acid po. Na-explain na po yung Doc. That's it.
So you're already done taking this na po ba?
Yes, sir.
Okay, so it says here naman dito done na, no? Routine nyo this. So sa irons, ma'am, have you noticed any changes po ba with your body or your functions of your body when taking iron supplements natin?
Such as ano po?
Like, let's say for example, when you lose your bowel or magtubo ka, have you noticed any watery stool or hard stool, yung constipation?
Connected po siya dyan, sir. Mahirapan po talaga ako mag-ano. Parang constipated po ako ever since nag-iron.
So actually, no, being constipated when taking iron supplements is actually normal because the body as a little bit, hindi po siya, kasi there is a specific amount of iron that the body is used to absorbing and taking. Now, if you take iron supplements, as I said, more iron you take, the more effort the body needs to process all of these or to metabolize this. Na since marami si iron natin, so it would indicate na medyo mahirap, no? It would take more time for the body to excrete this. That is why there is this constipation that you are experiencing. So, how can we address this? So we can address this po by, of course, hydrating. Okay?
Water.
Yes, hydrating via drinking water. So fluids, drinking water. So if you have more fluid intake, then of course your stool becomes more watery. So more watery siya, easier to excrete. Then you can also ambulate or you move around. Lakad lang po. So that it would be more, it would give more movement. It activates more bowel movement. Your whole body in general moves more, so your bowel becomes more active. Then via the food also, no, you take food rich in fiber. What are these? So these are yung mga green leafy vegetables. So can you give me an example?
Favorite ko po kangkong.
So that one, that's good for the green leafy vegetables. Yan sila. So if you take these, then they give you fiber. So more fiber gives you an avenue to excrete your bowel more freely and more comfortably.
Fiber po.
Fiber. Okay? So that's good. Any more medications po ba that you are taking?
Nano po.
Okay, so before taking any medications po mga discretion. If you plan to take any medications, inform your OB or your doctor, your physician first, because not all medications are safe to use, no, when you are pregnant.
Yes po, maka-affect po sa lesser.
Yeah.
Kahit po hindi na po ako ma-deliver masyado.
Yeah, especially the pain relievers, not all are safe because there's what we call teratogenic or dangerous to use drugs. So, of course, you can ask me, you can ask your physician, but better if it's a physician. So, you can also adjust the doses if needed or give you another alternative to be safe. Okay? So, a little background lang po, this time on yourself, your family, and your social history. No? So, may I ask if there is anyone in your family who has diabetes mellitus po ba?
Wala po sa side namin.
Okay. Both mother and father.
Yes po.
How about your
Sa husband ko po, sir, meron po sa mother side nila, pero like, distant na po.
distant?
Yes po, like, parang super exterior family na po ng mother side.
So like mga second cousin.
Opo, like, kapitbahay na lang din nila.
Okay. So that is noted. How about hypertension?
Meron
Your
po
high
sila
blood.
sa mother side.
Other side?
Yes.
Okay. So is there any history of cancer ba?
Wala naman po.
Genetic disorders, yung mga may Down syndrome or any abnormalities or any disfigurations before, after delivery or during pregnancy.
Wala naman.
Missing limbs or missing parts?
Wala.
Wala. Okay. So, ma'am, this time I'll be asking a little bit of your social history.
Yes po.
So, do you smoke po, ma'am?
No po.
Okay. Do you drink alcoholic beverage?
Si husband no po, pero occasionally.
Okay. And then, do you take coffee po ba?
Ngayon po na pregnant ako hindi. Pero I was a coffee lover no.
So, recently, did you take coffee?
Hindi na po. Ever since I was confirmed pregnant, so medyo miss ko na po talaga.
Still at least this, so that for the baby.
Malapit na po ang March.
Yes. Okay. So, last question po tayo. Where do you plan to deliver your baby po?
Sa Davao Doc po, sir.
Davao.
Sa doon po ako ginakuha ng nag-check up din first. So, doon din ako ginakuha ng BS.
Mga vital signs like yung mga everything na po, no? So there is your baseline data is there.
Ayun po yung husband ko, sir.
Okay.
Opo.
Hello po, sir. Good morning. So we're gonna take the VS after this po, sir. Ano ni Mommy. Okay.
Sa Davao Doc po kasi, sir, naka-inquire na po kami. Meron pa lang mga package doon. So,
Yeah.
nakaplano na po kami. Nandun na po kami.
That's good, no? So all for the best for your baby na talaga. So yung mga everything that I have mentioned a while ago, if you notice any abnormalities that I may have questioned a while ago, if you notice them, don't hesitate to come back here.
Yes, po.
Or to your physician.
No problem.
Okay, so that ends our health history po, no? And then let's proceed na lang to the vital signs check so
Yes.
that we get to have your baseline data. Compare lang natin. Okay? So, first things first, I'll just put this away na po, no? So, now that we are done with taking the health history po, no, we will now proceed with the vital signs check. So, of course, if we jump into the vital signs check na diretso, we have to introduce ourselves again to the patient, and then we have to verify the client, no, if we are handling the correct patient. Then, of course, we have to explain the procedure so that the patient will be well aware of what we are doing, and they would also be knowledgeable upon doing so. Okay? So just to be clear lang po, ma'am, I would like to ask again for your full name,
I'm Kendall Gender.
Kendall gender, and then your birth date,
September 5, 2000.
September 2005. So again, I am handling the correct patient. So since I'm ready, I can now proceed now to proper hand hygiene, putting on gloves. So while I put on my gloves, I can explain the procedure. So ma'am, if you're not well aware of vital signs check, so is this your first time for vital signs? So this is not your first time, but I'll just give you a brief ano. Are you aware po of the importance of each of the vital signs? Okay, so what I'll be checking po for you this morning are yung temperature. Of course, the temperature, we get to see if you're too cold, too hot, or normal lang. Then, sa temperature, after that, we will be taking your pulse rate. After the pulse rate, you'll be also
Yan yung
taking...
heart rate.
Yes, the pulse rate. From the word ng pulse, how many beats your heart does in a minute. Then along with that is the respiratory rate. So sa respiratory rate, we get to see also no, if you're breathing normally po ba? Or is your body compensating for it? Are you breathing faster? Are you breathing slower than normal ba? Whatsoever. Then lastly, we have po no, yung blood pressure natin or yung kinukuha natin better known sa what we call the BP apparatus or the better known or I mean the technical term for that is the sphygmometer. That one yan siya, no? So, it is common naman na, it's not your first time. Pa-BP ko.
Meron ba yung marami ba yung high blood sa side ng
I see. So that's why we have to check it, no? If there is any abnormality, if you're hypertensive ba at the moment or not. Okay? So this will help us indicate, no, if there is abnormality kasi blood pressure is one of the good indicators po talaga if there are any abnormalities in pregnancy. These are the most common change. This is the most common change that you will notice if there are conditions, especially pregnancy. Okay. So just type it up now, sir. Then we can proceed. Okay. So again, ma'am, I would like to inform you that everything that will be disclosed and gathered this afternoon, as usual, will remain confidential and private. Okay? It's between the both of us. So you don't have to worry about anything else. So since I'll be taking the temperature first, now I will position the client appropriately. So since the best optimal way of taking the temperature is via auxiliary method, then I will let the patient sit down properly and comfortably and insert the thermometer. But if in cases yung mga rectal thermometer or rectal temperature taking, then we can let the patient position in a lateral or SINS position, no? If we are going to insert a rectal thermometer. So this time, I'll be showing how to, you can also check ma'am, no, to ensure that we are handling a clean thermometer. So we have here the thermometer, then we have here an alcohol swab. So for the alcohol swab, this is with, as I said, alcohol swab. It is swab. It is the wipes now with alcohol na yan siya. It will help us disinfect. So in order for us now clean the thermometer, the rationale for this always is from cleanest to dirtiest. Since this is not yet used, we are going to do it from the tip to the body. So from the tip, twisting motion, firm twisting motion. Then this part. So once that's done, we can place the thermometer into the patient na. So, ma'am, I will be inserting the thermometer na. So I'll raise your sleeve lang po. Sorry feeling po. Okay lang. So, raise the sleeve lang po. And then, once the sleeve is raised now, I will be inspecting I'll be inspecting lang the underarm or the underarm for any lesions or any perspiration. So if there are lesions, of course, it might cause discomfort or pain to the patient. And then for perspiration, we have to wipe this if there are any perspirations so that we will yield accurate results. Because if there's moisture, it may alter the temperature to get it too cold. Okay? So assuming now that there are no perspirations and it is safe to use, then I'm going to turn on the thermometer. Then, once that's turned on, I am going to insert this now in the mid area of the axilla. So, mid area. Then, ipit lang po natin siya, ma'am. And then, arms crossed. So, with that, we're just going to wait until the thermometer makes the sound or indicates that it is already done. So, in an ideal setting, we can already take the respiratory rate, the pulse rate, together with the thermometer, so as not to waste time also if we are catching up with time. But since this is a return demonstration, we want to optimally show the step-by-step procedures, then ideally din to yield accurate results, we have to do it one by one, lalo na if this is your first time. So, assuming this is my first time and this is proper return demonstration, then we just have to wait with until the thermometer makes the sound or indicates that the taking of the temperature is already done. Okay? So just wait for it. And after this, if you're already done, then we can proceed now to disinfecting again and then make it ready for the next use. Okay? So it will just make a sound now, or it will start blinking when it's already done. Okay, so that would already indicate that the thermometer is already done. So ma'am, I'll just roll down your sleeve, make it comfortable. Thank you, ma'am. So the reading says 36.7. Degrees Celsius. So 36.7 degrees Celsius po, ma'am, is actually normal. So the normal range is 36, 36.5, give or take. 36 to 37.5 degrees Celsius. Anything above is hyperthermia or too cold, and anything below is, anything above is hyperthermia, too hot, and then below is hypothermia, too cold. Okay? So 36.7. So since we're done with that, we can now wipe the thermometer ready to be used for the next patient. So this time, cleanest to dirtiest. Cleanest is the body going to the tip of the thermometer, which is the dirtiest. So still, twist to firm, twisting motion. Okay. Discard, then store the thermometer. So again, I have already recorded the temperature and ensure that I'll be passing this on to the to the concerned physician. So with that, we can now discard the gloves and then prepare for our next procedure. So discard gloves. Do proper hand washing. But since walang hand washing, to prepare the spread of microorganisms, hand washing. Okay? So if you can wash the thermometer and it does not break, you can also do so now. Okay? So So we have already stored it and it's ready for the next steps. Okay, so this time we are going to assess the your peripheral pulse, or otherwise known as the pulse rate, or how many beats your heart makes, along with the respiratory rate. So let me just explain the steps for the pulse rate first. So again, I will be selecting the optimal pulse point. So the optimal pulse point is usually in the radial portion, the one below the thumb, no? So unless it cannot be palpated, or it is not there, probably your patient it may be covered with, let's say, IVs or anything else that may be covering. Then we can find another portion to palpate the pulse, but more or less they're all the same naman. Okay, so this time I will be considering the radial pulse, and then I am going to use that area to assess for the pulse rate of the patient. So I am going to assist my client again into a relaxing position. So ma'am, position na natin ayos, feet flat on the floor. Thank you. So the patient is very comfortable. Are you comfortable?
So much.
Do you want me to adjust the temperature?
Okay naman po.
You want a cup of water before we proceed? Okay. So, it is ready na, no? So I am going to bend the client's elbow in 90 degrees position. But if optimal on 90 degrees is talaga siya, perpendicular and siya gano'n. Since the table is a bit elevated for the patient, then we can consider naman for the sake of this RD naman 90 degrees back up. Since wala, I'll just be doing this. Okay, so extend. I extended the arm, extend na rin siya ganon, and then I'm going to flex the wrist. The palm should be facing downwards. Okay, so ma'am, just in order for us na wala po siyang distractions or anything that may be hindering us along the way, would you mind po to take off the jewelry?
No problem.
Okay, thank you. You can place it here on your pocket. Okay, sige. So, next I'm going to palpate and count the pulse na, no? I'm going to be placing the first 2 to 3 fingers, no? If the area is large, you can use 3 fingers. If the area is small naman or just enough, you can use 2 fingers over yung groove of the thumb, which is somewhere here, no? Somewhere dito ng patient. Then inner wrist po, I mean sa inner wrist po. Okay? Yeah. So I'm going to also, along with that, assess the rhythm of the pulse. So is it pounding? Is it too strong? Is it too weak? Or is it quick? Is it slow? So I'm just going to assess it all, no? Along with the volume, if it is evident ba or hindi. Okay? So with that being said, later on I will be documenting it after. So along with that, the next portion, I'll just be explaining it now so we can do it simultaneously, because again, respiratory rate and pulse rate comes hand in hand. So I'm not going to tell the patient that I'm taking the respiratory rate because the patient might be conscious about taking the respiratory rate. So her respiratory rate or her breathing might be too quick, too slow, according to how she feels or how she thinks the outcomes must be. So without telling the patient, we can take the respiratory rate as well after we take 1 minute of the pulse rate. So more or less 2 minutes na siya, combined pulse rate and respiratory rate. Okay? So now, I'm going to start with the pulse rate. Okay? So, just going with the 2 fingers now. I'm going to separate. Okay, I feel it now, so I can start 1. So without consuming too much time, no, I'm going to assume that it's already 1 minute, and without telling the patient, I've already noted that it is already 70 more or less. Let's see, because the normal is 60 to 100, so 75. Okay, so assuming that was 75. Okay, so I'll document that later on, along with the different characteristics of the pulse rate. Okay, so moving on to the respiratory rate. Sige, pause ko lang po muna kung pause. Okay, so pahinga muna patient. So next is the respiratory rate. So for the respiratory rate, no, I'm going to be observing also the patient's rise and fall of the chest, and I'm going to count how many cycles this is. So one rise and one fall is considered as 1. Okay, so I'm going to be doing this for 60 seconds and then 1 minute. Then I'm going to document now the different characteristics like the depth or the rate and the rhythm. No, is it too fast? Is it too slow? Is there any struggle to breathe, or is there any deepness of breath? Is she trying to catch her breath back, or whatever that may be necessary to do? So assuming now, going back again, assuming I did not stop, the one minute has passed for pulse rate. This time I'm already taking the respiratory rate. So eyes on the chest, rise and fall. So ganun lang yan siya, and then 1 minute again. So the optimal for this is 12 to 20 cycles per minute. So let's say I already finished the 1 minute to save time. Okay, but in ideal setting, I'll finish the 1 minute. So 1 minute. So ma'am, already done. So I'm going to tell the patient, so your pulse rate is 75 beats per minute. So that actually falls within the normal range, which is 60 to 100 beats per minute. Okay. Then for your respiratory rate, is 14 cycles per minute. So it falls within the normal range of 12 to 20 cycles per minute. So I'm just going to document everything now. Okay, so once everything's documented, and then I have noted, since there are no abnormalities, but if you notice any changes like the skin color, as I said also a while ago, yung mga lesions, or the abnormal pounding sounds of the heart or whatever, take note of them in your TPR sheet or the jot down notebook, and then immediately refer to your health physician. Okay, so for the last one, the last vital sign we're going to take is the blood pressure. So this is very important. This will serve as a basis or background for your blood pressure, so that if there are any out of the ordinary, below hypotension or is it above hypertension, then we get to compare findings. We can check again and ensure if this is actually your blood pressure as well. Okay, so first is I will be ensuring that everything is intact. Since I touch the patient, of course you can do hand washing and hand hygiene as frequent as possible. So materials to be needed. Of course, the sphygmomanometer and the stethoscope. So with that, everything should be intact and everything should be functioning. So I'm going to be checking the cuff size. So assuming that the cuff size is perfect for the mother, the patient, the client, then it is what I will be using. So I will then be checking if it is correct. If there is any leakage or is it retaining its, when I inflate it and deflate it, is it functioning well? So it retains, and when releasing, you can see that the indication of it rises there, but it indicates the pressure. Okay, so it is functioning well. So before proceeding, we will check with the client if she is ready to be for her blood pressure to be taken. So ma'am, how are you so far?
I'm fine.
Okay, so I'd like to ask na po, did you take po any caffeine prior to this?
No.
Okay. So diba you said naman din you do not take caffeine recently because of that. So also establish rapport and remember all the things that you have shared or she has shared with you. So you did not do any heavy walking po ba going here before this vital signs or before the interview po ba?
Naka-recover na po kanina sa interview sa
And also now we already checked the respiratory rate and pulse rate. It falls within normal na, so it may indicate na she is already stable. Okay, so now we are going to determine the best site to use to assess. So basically, if both arms are viable, so the best site to use is the left arm. No, the left arm is nearest to the heart. That is why we are going to use that portion. So since we're going to use the left arm, you're going to read the position of the client. Okay, so ma'am, I'll be taking your blood pressure lang po on your left arm. Okay, so feet flat on the floor lang po, and then straight lang. Then after that, no, the elbow will be slightly flexed. So ma'am, I'll flex again, the same lang on the floor. So it will be exposed, and then I'm going to fold your sleeve lang to expose the area. So, once that's done, we have to ensure the hand is also facing upward. Once the hand is facing upward, and then arm is at heart level, so that the flow of blood will be normal lang din, and then there's no difficulty struggle due to gravity or whatsoever. Now, when we have exposed the arm already, we can start to wrap the deflated cuff. Ensure that it is deflated. So, estimate lang so that we did not cover the brachial artery. So, I'm just going to find it now. Okay, so I found it. It is the area around here. So we do not want to cover that. Cover that, and then we do not want it too tight or too loose. How do we know that? First, we can check, ask the patient, ma'am, is it too tight for you?
Okay na.
It's okay for the patient. Then we can check, put 2 fingers inside of the cuff. If it is too loose, then adjust. If it is too tight, you cannot put your 2 fingers inside of the cuff to adjust. No? So mine is too loose, it's going to adjust. So upon doing so, it's enough na. So after that, I am then going to be using my stethoscope this time, checking the stethoscope. Then I am going to attach the ear. But before I attach it, I am going to ensure that it's clean. Why do we have to make it clean? Making it clean ensures that there are no dirt or debris that will hinder us from hearing the optimal cough sounds, because we want to hear it properly without any hindrance. Okay, so ear attachments are clean, discard. Then I'm going to insert it to my ear, and then going to push it in such a position that it follows the opening of my ear. That is why we have to push it forward. Then it is tilted slightly forward. That. Then ensure that the stethoscope hangs freely from the ears to the diaphragm. Nothing in between them. Okay, so we hear optimal sound of the heart. So checking lang now if I can hear it, and true enough, I can hear it. So I'm going to place the stethoscope directly on the skin, not with anything in between it. So again, double check. Okay. So I'm just going to place it now. I'm going to place the so while holding the bladder, I am supporting it 2 fingers. then thumb down to support the elbow, and then I'm going to start to listen to the chord of sound. So I'm going to raise it approximately to pump the cuff to 30 millimeters of mercury, or until the sound disappears. So slowly listen. So release. So, I then now release the pressure, because I already heard the chord of sounds 1, 4, and 5. So thank you, ma'am. Roll down. So let me just explain what I was listening to. So basically, what I was listening to, I pumped up the sphygmo manometer to about 30 millimeters of mercury up, and then releasing it slowly, So what was I hearing? So Korotov sound 1, this is the first tapping sound heard during yung deflation, So yung systolic BP natin, we get to hear it first, yung first click when deflating the cuff, 1 to 2 millimeters of mercury per second, So pop, first pop, that is the first systolic pressure, then until the last faint sound. So the last faint sound is the Korotov phase 5. So that is the last one, and then pop, then done. So that is the diastolic pressure. So upon hearing now, ma'am, your blood pressure is 110/70. So that is actually normal. The normal blood pressure for systolic, or the number above 110 should be 100 to 120, and below is 6. The normal should be 60 to 80. And yours was 70.
Yes.
Okay, so that is everything on blood pressure. So if this is the patient's first time to take the blood pressure, then we can wait 1 to 2 minutes to let it rest, and then we can get accurate results. So first time, it is important to compare the blood pressure, the first take, second take, or as many takes that you took. At least 2 yan siya, So if there is, let's say, about 5 millimeters of mercury na negligence or difference between them, then there must be something wrong. So we take it again, After the 2, we see that there is correction, or yung difference, a large gap between the 2. We can take it again. And then if we still see that there is an abnormality, or there is an awkward change of temperatures, we can average this and get the mean of this one. We get the average, and that will be the blood pressure of the patient. Okay, so with that being said, if you can take it again as many times as you want to yield accurate results. Okay, so let's say na average ninyo, then you can put that there if it is already too many times. But the best optimal result for this is to actually take it as many times until you yield the common blood pressure of each. So that's it. You can take also the other side of the arm. If you already taken the left, you can take the right, then compare the results. So there should be no difference of at least 10 millimeters of mercury between the 2 arms. If there is, then wait again, 1 to 2 minutes, and then retake both arms, then compare. Then that is the actual blood pressure of your client. Okay, so I've already removed and that is already done. And then once that's done, we can again, just like the thermometer, we can take a alcohol swab and then disinfect the cup, ready to be used for the next patient.
Pwede kang makaisot.
Yes, go ahead.
Thank you po.
Thank you for your cooperation. So, as that's ready, set that aside. So, once everything's done, no, document again. If you notice any abnormalities, then report immediately depending on the urgency, if hyper, hypo, or any abnormalities arise. Okay? So that actually ends our vital signs checking na po, ma'am. So we're already done in 2 parts. Then we'll be performing the last portion na po, which is the Leopold's maneuver. Okay? So in preparation for the Leopold's maneuver, I will help you na po to empty your bladder, so mag-urinate lang po tayo so that you will feel more comfortable later on. And then, I will help you to change into your examination gowns. Then we can proceed to the examination room for your Leopold's maneuver.
Pwede po isama si husband.
Sure. You can stay near the ano lang po, basta hindi lang interrupt with the procedure. Okay? So, we'll now proceed to the next portion. So now we'll proceed to the Leopold's maneuver. So this portion, I have already helped the mother empty her bladder, and then I have already helped her change into an examination gown. So with that, I am now going to start off on the procedures for Leopold's maneuver. Okay, so first things first, I will be washing my hands to deter the spread of microorganisms, but since a sink is not viable at the moment, I'll be using alcohol to do proper hand hygiene. And then, after that, I'll be donning on my gloves to protect myself and to protect the patient from cross-contamination. Okay? So while donning on gloves, I can establish a porno. So, ma'am, how are you feeling?
Ay, look. Ako namang husband, sir.
Ayun! Hello! Good morning po, sir. So while I'm doing this lang din po, no, I'm just going to explain to the both of you what I will be doing in this procedure, no. So what I'll be doing po is the Leopold's maneuver. So Leopold's maneuver, that would mean I will be doing four maneuvers or four procedures that will help us identify the different positionings, no, of your baby. So it may indicate how your baby is positioned. Nakatayo ba siya? Is it longitudinal? Is it transverse? Is it oblique? No, oblique, ibig sabihin slanting. Or we can also find out if the baby is flexed. But flex is the normal position where the head is down. Or you can also know, no, if the baby, what part of the baby will come out of you first. Will it be the head? Will it be the butt? Will it be the shoulder? So by this way, we can also plan, your delivery and plan your current pregnancy. How we are going to approach it with the specific positioning of your baby via the Leopold's maneuver. Okay. So I'd also like to inform you as early as now that you will feel discomfort in the duration of this because of course I'll be pushing up against your abdomen lang yun po, no? As we progress. So tell me if it already feels too much, so we can pause and rest, or if you want to use the restroom again, you can do so. But that is why I have already helped you to use the restroom. So dire-diretso.
Yes.
Okay. So prior to the procedure, no, warm your hands by rubbing and ensuring that it is appropriate na for to touch the patient. Okay? So will this be enough for you?
Yes,
Okay. Okay. So with that being said, let's now start, no? So do you want to use the restroom again?
okay na po.
Okay. So para diretso. Okay. So I'll help na po si Ma'am Sir na in a supine position, lying down position. So you can start. Okay.
Tulong po ako.
Oh, sure. Sige, hawak mo ako. Okay. So, what I have here now is the pillow for comfort the head, to support the head. Then I have a pillow below the knees so that the abdominal muscles will be relaxed. And then what I have here also now is the rolled blanket, or it can be another pillow. So this will be put under the right side of the mother. So, sige, I'll help you up. 1, 2, 3, go!
Yes, sir.
Okay, so this is to prevent supine hypotensive syndrome, wherein the weight of the uterus presses on the aorta and the vena cava in that area. Okay? So that is what causes usually yung mga hypotension or low blood pressure. Okay, so with that, I will also be standing on the right side of the mother because I am right-handed as well. So for easy access, no? Then with that being said, no, I will now prepare the mother. Just cover the areas that we will not be examining. So that will be the area, no? So ganyan. Then exposing, I'll now expose na po the area, the umbilical, I mean the abdomen. No? So I'm just going to overreach a bit po, ma'am. Would that be alright with you?
Yes po.
Okay, so I'm just going to raise. I'm going to raise this. Yan. So exposing only the abdomen. Okay. So once that's already done, no, I am already ready, and then I'm going to start with the first maneuver, which is the fundal grip. So the fundal grip, ma'am, from the word itself, fundal, so it is in the fundus, upper part, portion of uterus. We are going to identify if what is the opposite part of the presenting part. So would it be, we would know a bit na po if it would be a cephalic type of delivery or presenting part, or would it be a breech or yung butt. Cephalic is the head, breech is the butt. Okay, so I'm just going to press it using my palms only, no, in a firm but gentle pressure on the mother. Okay, so I'm going to start lang po, mama. So fundal grip, fundus. Ganyan lang siya. Okay. So I am feeling, no, a soft and irregular shape on the fundus, so that may indicate, no, it gives us a clue that the part on the fundus is the butt of the baby. So later on in the Pollix maneuver, in the third, Pollix grip, no, we would get to confirm this as well if the presenting part or the opposite part, the presenting part would really be the head. So would it really be a cephalic presentation. Okay, so that is done for the fundal grip na po. We are going next to the umbilical grip. So the umbilical grip, ma'am and sir, this would help us to identify, no, if we would help us identify where the fetal back is together with the extremities. So would it be on the left of the mother po ba, or would it be on the right? This is the fetal back would also be our basis for listening to the fetal heartbeat. Okay, so again, firm pressure pa rin. I'll just overreach a bit, ma'am. Okay, so just going to press it now. Supporting one hand muna at the other side, and then on the other side will be the one with me. So I'm going to start with the mother's right. Okay, now this one will stay, and then this one will move to this side. Okay. Upon palpating, no, I'm just going to document it both na so kanina, I have noted that the butt was on the fundus, and then on the abdominal, on the umbilical grip, no, it is on the right side of the mother where the irregular bumps, which would indicate the extremities, no, fetal extremities, and then there's a flat, smooth surface on the left of the mother that would indicate the fetal back, no, which is on the left side. So we already have one back left. So now we will proceed to the third grip, no, which is the Pollix grip. This is to check the engagement of the baby and to confirm if the presenting part is actually cephalic, no? Okay, so we are going to proceed. So ma'am, Pollix lang yan siya from the word itself, po. So I'll act like a po lang yan siya dito sa umbilical with this part. We're going to check lang po the presenting part first, okay? So we'll start. Okay, so I feel a firm round. Okay, so that would indicate, no, the head of the baby. So most likely cephalic po yan siya, the presentation, which is normal. I'm going to move it lang, ma'am, to check if it is engaged na po ba. So, left, right, up, and release, up, release. Okay, thank you, ma'am. So that will actually indicate po, no, that it is still, it has not yet engaged, and it is still freely moving within within the uterus of the mother. Okay, so not yet engaged siya. Then again, the presenting part is the head. No? So it can be a cephalic presentation. You can say it is a cephalic presentation. So left occipital na siya. So lastly is the pelvic grip. So the pelvic grip is going to confirm everything from the first grip going to the third, and then we are going to check for the fetal attitude. If the baby's head and extremities are flexed, deflexed, or extended, and you can also check for if it is anterior ba or posterior, or is it transverse ba na type of presentation. So yeah, that we would be checking that along the way as we feel from the symphysis pubis going up to the focus. Okay, so I'm going to turn na po this time on the patient's feet. Then upon checking on the patient's feet, I am going to start off. This time I'm going to use the sides of my hands, and then I am going to palpate for the pelvic grip naman this time. So I'm going to review everything if this correct. So I'm going to start off na, ma'am, I'm just going to overextend a bit lang na.
Yes po.
And then, so I'm going to start here, bottom, going up. This is pubis. Okay. Yan. Okay, again. Okay. So, thank you, ma'am. So I'm just going to put this down for a bit for the explain. Okay. So basically, what I have, palpated, no, that yes, it is already, it really is on the left side, see, flat and smooth surface, which would indicate the fetal back. And then upon palpating the extremities of the right side, I can feel that it is smooth also, and it is continuous. That would indicate no bumps, no abnormalities. So the chin is not bulging out, nor is there any gap in between it. So that would indicate that it is a flexed position or flexed fetal attitude. So also, no, there is a bit of, I can feel the fetal back slightly elevated towards the left side, so that would also indicate the left occipito anterior. So left occipito anterior. Okay? So now that we are already done with the Leopold's maneuver, we can now proceed to the fetal heart tone. So upon checking for the fetal heart tone, we have just to remember that it is on the left, and it is a cephalic presentation. So the fetal heart tone is near the head, so it is going sa lower quadrant or sa lower part of the abdomen. Okay, so I'll just prepare my stethoscope and ensure that the stethoscope is not too cold. Just going to warm it. We'll be using the bell because we're listening to a deep sound, no, the baby's heart tone. So once that's ready na, no, I'm just going to expose again po, ma'am. Okay. Ma'am. So left tayo, no, left yung mother, and then occipito, so it is on the lower part, is going to locate it. So we already have identified the fetal back. You can do again the maneuvers to identify where the fetal back is. So since left na siya, I have noted that the area is chest, bell. Yeah. So I'm going to listen to it, no, finding from top to bottom. I mean middle to lowest part. So assuming that I have found the area, I'm just going to time for 1 minute, and I'm going to assess the rate, the character, and also if it is too quick ba or it is pounding, too strong, or too weak. No? So normal is 110 to 160. So I'm just going to listen for 1 full minute since I've found it. So assuming it was 1 minute and I have listened to it, ma'am, do you want to listen
Yes,
to it?
oh, so
Okay.
much.
I will clean the stethoscope lang now so that you can listen to it. Ayan siya, ma'am. So asan yung kanina, ma'am? I'm going to find it for you. Sige po, listen. Do you hear it po? I can adjust it if you don't hear it yet.
Yes.
Ayan.
Oh my gosh.
So that is the fetal heart tone of your baby. No? So,
She's alive.
she's alive. So, do you know the gender of your baby na po? Or do you want to keep it a secret until
I just
he or she
noticed
comes?
she's a she.
Okay. So, female pala si baby. Okay. I'm just going to cover it back to ma'am now. So, the normal po is 110 to 160. And as I've said, no, it is at 120 beats per minute. Ayan. So, mesmerizing siya, ma'am. No? You have already heard the baby and her fetal heart po.
She's a beatbox.
So, that is actually normal ng this galloping sound. It is because faster talaga. Kasi di ba, well, we did vital signs, kaya 60 to 100 ang normal natin. Sa baby is 110 to 160 because she is very active inside. Anyway, let's proceed na po no, to the measurement of your fundal height. Just to confirm if actually ba talaga na 30 weeks na po pa kayo. Because the McDonald's rule states po no, na how many cm from the symphysis pubis to the top of the fundus, that is actually how many weeks is your current age of gestation, or how many weeks your pregnancy is. Okay? So, I'm gonna start po by erasing lang po your examination gown na. Okay. Then, I'm gonna start now. Be careful also with the measuring tape because it can cause cuts or abrasions because the skin of the mother also no, is very sensitive as well. Careful lang tayo sa pag-measure nito. So, I'm going to start at 0 sa symphysis pubis. Symphysis pubis. Ma'am, excuse lang po, ma'am ha. Symphysis pubis going to the topmost part of the fundus. Dito. Perfect talaga siya, 30. So, it is actually 30 centimeters exactly. Thank you, ma'am. I'm going to put it down. So, according to McDonald's rule, plus minus 2, give or take. So, most likely 30 weeks po talaga si mother natin. And the fundal height is 30 centimeters. Okay. So, with that being said po, ma'am, I'll help you up na lang po.
Thank you po.
Okay, so I'll just bring down this coffee. So basically, that sums up everything po, ma'am, no? Let me just sum up lang, no? So sa Leopold's maneuver, we yielded results that your baby is located on the left, and the presenting part is the occiput, no? Or it is a cephalic presentation. So the head will be coming up first. Then anterior siya, so ang back niya is nakaharap sa iyong front. Okay, then 120 beats per minute si baby and you are 30 fundal height is 30 centimeters, so that would indicate 30 weeks. Okay, so just a little bit check lang po, no? Have you already taken your labs na po?
Yes po, pero wala pa. I think ito po alam ang results.
Okay, so the results are not good. But are you already aware na po ba of all the manifestations of what is the
No po, because we have already received the labs, but of course, like, with the obstetrician, they absent, we don't know really that.
So basically po, ma'am, the best way to interpret your labs is actually directly po talaga yan siya to the OB or to your physician, because they are the ones duly obligated and duly have the power to give you the manifestations of your labs. So for me, no, the most that I can tell to you is the importance of these labs and what they may indicate. Okay, so we have the urinalysis ma'am, di ba, did you have really requested to?
Yes.
I think I have a copy of the lab request here. Hindi, sige lang. I think I have a copy here now. So I have the urinalysis. So for the urinalysis, that would actually yield us now with the if there is sugar in your urine, if there is protein ba in your urine, or if there is anything in your urine. So if there is sugar in your urine, then what's the most common indication pag may sugar po? You know? Diabetes,
Oh.
yes. So, di ba sugar usually diabetes? So there is a problem na with filtering out the sugar or using it for energy. That is why naiihip na po siya. That is why it's important because gestational or yung diabetes mellitus in mothers is very common as well. We have to understand that we have to ensure that there is no sugar there. No,
So I also have to watch my sugar intake.
yes, your sugar intake also. No, if as said by every as I experienced also din in it is factually stated din talaga yan siya ma'am na when taking when especially in pregnancy if mahilig sa sweets then as much as possible iwasan na natin sa sweets. Why? Because sugar is very much abundant. Mahilig po ba kayo sa rice?
Yes, sir.
So nasa rice na maraming sugar. So if kaya try gradual lang muna na fast from sweets because sugar is already rich in glucose. It is enough na to supply your sugar needs. Anyway, so yung protein natin, protein would indicate also yung proteinuria or these are early signs of preeclampsia. If you're not aware of preeclampsia, this is yung gestational hypertension, yung pre-hypertension ng mga mothers natin. So this why may naiihitay na urine, it is because may naiihitay na protein because the kidneys are not filtering it properly. So this is why may lumalabas na protein. Okay? And then we also have yung CBC natin, yung complete blood count or yung blood typing natin. So blood typing natin, we will know if there are any abnormalities in your complete blood count. We get to know if there is, if you are anemic ba, or if there is an increase of white blood cells, which may indicate signs of infection, so on and so forth. So we have to know all these para kung anemic din po kayo, and we know the blood type that you have, then we can, if we are to do blood transfusion, it would be easier for us to locate for you a suitable donor. Okay? And then we also have yung mga cervical smears natin. So na-order din po kayo ni Doc sa inyo.
Yes.
And was it done na po ba sa laboratory? Ni Doc pala. Si Doc pala gumagawa niya. Nagawa niya po. So sa cervical smear na malalaman, we would know there if there is any cancerous cells. Iba po pala yun. If there are cancerous cells coming out there. But that would indicate if meron man, God forbid, then we would be able to do something about it as early as now without symptoms pa niya lumabas. Yun pa lang siya. Yung pap smear natin, malalaman natin compatible ba si vagina and all your reproductive parts to deliver this baby and to keep going on with this pregnancy. Okay? And then, yeah, I think that sums up everything. So, is there anything else that you would need to
Next
be
month again, sir?
Yes, next month again,
Same.
hopefully, with yielding good results just like now, no? So I'm just going to use, do hand washing lang po na. And then, hand hygiene para one of the viables. So ma'am, thank you very much for your cooperation. And sir, thank you very much for allowing us to do all this. And do not hesitate to go back here or to your obstetrician or your OB if there are any questions or concerns. No? So, continue lang ma'am. So, pantay-pantay lang tayo sa hypertension. And then, pwede ka maresetahan po ni Doc for a discount if you would want to purchase an automatic BP apparatus. We're speaking na lang. May discount po yan siya. Basta may reseta nito. Hingi lang po kayo sa akin. Okay? So, keep track of your hypertension now because, again, there's a background and we want to prevent this from occurring in case na meron po talaga yan siya. No? Madadamay po pa kayo for everything. So, with that being said, last, do you have any more concerns or questions?
Ano po?
Okay, so
Thank
ma'am,
you so
thank you for
much.
being so cooperative, sir. Thank you for your patience also. And with that being said, that ends my return demonstration of the 3 topics. Thank you.